Your story, again, somebody can go back and listen to the full version on our first episode, which we did on episode 265. But can you remind us, kind of what has happened to get you where you are and where you are currently with dealing with things like grief, for example?
Yeah, thanks for asking. So I am currently a full-time medical weight loss doctor, metabolic health specialist. But how I got here is pretty interesting. I was a 306-pound primary care physician. And when I was in primary care, this was like in my late 20s, I was training at Tufts and I was diagnosed with type 2 diabetes. I had an A1C of 8.7. I had obstructive sleep apnea with a CPAP machine. I had high cholesterol, high blood pressure, fatty liver disease, depression. And really, I developed all of those diagnoses over the course of like 10 years. Like it was a very slow burn. I gained like 10 or 15 pounds a year every year after losing my father. And between losing him at such a young age to metastatic melanoma, he had skin cancer, and like the rigors of college and medical school, I just slowly but surely put on like way more than the freshman 15. And I ended up at 300 plus pounds. And so I was like, not practicing what I was preaching. Like I was a primary care doctor seeing patients who weighed less than me with problems not even as bad as me. And then, of course, I'm telling them, or advising them on what they should be eating or what they should be doing, and obviously not following any of that myself. And so when my sister was diagnosed with terminal cancer, this was an ovarian type of cancer called a germ cell tumor. I kind of switched my tune. And so instead of just like, rolling from 300 pounds to 400 pounds, I was like, I am faced with this decision where my sister is diagnosed with this cancer that's like incurable, and she has no choice but to undergo surgery and radiation and chemotherapy. And she was undergoing um like stem cell transplants and like kind of investigative immunotherapy. And I was left with this decision, like I can continue to choose to go down this path, like continue to have uncontrolled type 2 diabetes, or I can smarten up and like make the right decision and change my life around in order to be there for her kids. And so I got into this field and really did a lot of research in metabolic health and hormones and like a hormonal biological approach to obesity myself. Went low carb, followed like a therapeutic carbohydrate restriction program, intermittent fasting, dropped 125 pounds, and then switched fields from primary care into medical weight loss. And that's kind of like what brings me to where I am today. And my sister ultimately passed away, which is horrible. But I would say the only, okay thing, I can't call it good, that came out of it is that like I transformed myself and have really helped so many patients out of that transformation, because I feel like I'm like inspiring and motivating to my patients since I've lived this myself.
Yeah. Wow. I just, I don't know, man. I've gone through losing a parent to cancer, and it was terrible. It sucked. I still to this day kind of believe that to me, it looked like the treatments for cancer were really what did a lot of damage. I don't know what the cancer itself would have done in the end. And what I mean, obviously, we could have changed the diet in a different direction than we did at the time, and that was hard enough. But to like have that repeated in your life with your sister, and now you've got young kids involved, and like I don't know, that's such a heavy trauma. How are you doing with that these days?
Therapy is helpful. Also, I think having a therapist who like understands grief really well and understands like food addiction and eating disorders, binge eating disorder, night eating syndrome, like having a really well-versed therapist is really helpful, because it's not just a sounding board. It's like someone who can help you with cognitive behavioral therapy, and it's not just someone to like reflective listening. It's not just for reflective listening, it's for like treatment of these things. Like I know that I have, binge eating disorder, and I know that I have like addictive personality when it comes to certain foods. And so that's been so helpful in terms of grief. So I always encourage people who go through like the loss of a loved one at such a young age to definitely seek mental health counseling. I think I'm okay. Like I'm in a lot of a better place these days than I was when it first happened, because I was filled with like so much rage and, anger and sadness and sorrow. And I think accepting that like who you are as a person changes permanently when you lose someone that close to you is okay. You know, like I'm just not the Kevin that I was before I lost my father or my sister, especially my sister, because it was just so heartbreaking. And that's like okay, like it's acceptable to be a different person. I think I've been like hardened in a way that I wasn't before. Not that I'm not still kind of a softie, but you know, I'm still just a different version of myself, and that's okay. And this version of me is very helpful for my patients in a way that I have more insight than I had before.
Yeah, yeah, I was reflecting on that as well. Thank you for sharing that. I appreciate it. I have seen many people over the course of almost 2 decades of personal training and nutrition coaching lose the amount of weight that you have lost, and I've seen them do it in various different ways. And I think for most people, if they've never lost that much weight and they need to lose that much weight, I think they can do it at least one time with calorie restriction. I think it's going to be really, really tough. I don't think you can do it more than once because of the damage that it causes eventually to the metabolism.
Because
But
your basal metabolic rate lowers every time you restrict your calories and totally like
exactly,
breaks your metabolism.
exactly. It's creating the perfect circumstance for that weight to come back on. I mean, my whole career when I was working back at the gym was using metabolic carts to measure metabolic rate on people, and that's exactly what we would see all the time. Is you're just going to take down your metabolic rate. So again, I think you can lose it your weight once, but you'll probably cause a rebound. And it's very difficult to maintain. I've also seen other people choose a different route. They lose that much weight, but also they keep it off. They look like you look like you've never been a pound overweight in your life. I just saw you in person. You look phenomenal. You've been able to maintain this weight loss. What can you say about the way of eating and lifestyle that you've chosen that not only allows you to lose the weight, but also to keep it off? Like it hasn't seemed like it's been a big issue for you for years now.
Thank you. I honestly think that when it comes to things like disordered eating, right? Like, let's say the reason why you got to the place you're at now is you're 300 pounds because you binge a lot, right? You have binge eating tendencies. And part of that binge eating is like ultra processed food addiction. Like you are just like addicted to these foods. You get a little dopamine surge every time you have them. And then while you're binging, you feel better mentally. And then immediately after, of course, you feel like crap. That is like such a common picture that I see in patients. And it's really not that like binge eating is cured. It's just how often does it happen? Like, are you binging and splurging on some crazy food on Thanksgiving, like once a year, or like on your birthday, a couple times a year, once every quarter? Or is this like a 3 times a week kind of thing? Because if it's 3 times a week, it's like so disordered of an eating pattern that you're going to have no choice but to just slowly but surely gain the weight back and go right back to where you started. So it's really not that I've like cured these issues. It's that like the binge eating and the emotional connection to food and that like dopamine surge that I feel, it's just happening so much less frequently. It's like an occasional meal at a wedding or a birthday or Christmas. And the vast majority, 99.9% of the time, I remain low carb. I still do intermittent fasting. Even on days when it is like a splurge and I'm on vacation and I have a cheat, it's still like I'm cheating in a fasting window. Like I have a short eating window, or I'm doing like OMAD, 1 meal a day or something. So it's just like the baseline approach to the diet has changed. And this is like what I try to teach to my patients is there's this body type of insulin resistance. And if you have metabolic dysfunction where you have low HDL, which is your good cholesterol, and you have high triglycerides, and you have this larger waist circumference and an elevated HbA1c, hemoglobin A1c, and high insulin levels. If you have a picture like that, then your body type is just not going to respond well to processed foods, sugars, um, carbohydrates. And so if you go low carb, low sugar, increase your protein, healthy fats, and fiber, then you will like naturally fix that hormonal imbalance, naturally lower your blood sugar, or at least regulate your blood sugar, lower your insulin levels, lower your triglycerides. And that's your new default diet. So it's like this is the body type that you have, the cards that you were dealt, right? There's worse cards to be dealt in life. Like you could be diagnosed with MS or cancer or whatever. Instead, you're dealt a hand of cards where your body just doesn't process like rice and bread very well, because with rice and bread and pasta, you just put on weight so easily. And so this is so many of my patients. And I just explain it like that. Like your body type can't handle these carbs and sugars. And so your default meal plan needs to be meats and vegetables, which is not really that groundbreaking. It's kind of like an ancestral approach to eating.